Do you leak urine when you laugh, sneeze, or can't make it to the bathroom in time? This scenario is not unique to you, and you don't have to suffer in silence. In this video, we break down what urinary incontinence really is, what causes it, the most common symptoms, and, most importantly, how you can take back control. Let's get into it. Let's start with the basics. What exactly is urinary incontinence? Simply put, it means leaking urine or losing control of your bladder. It might happen when you laugh, sneeze, or even for no obvious reason at all. And while it may feel embarrassing or isolating, here's something you need to know. This condition is not unique to you. Urinary incontinence affects millions of people around the world, of all ages and genders. Yet many suffer in silence because they think it's just something they have to live with. But that's a myth. The truth, it's treatable. In fact, there are real, effective solutions that can reduce, and in many cases, completely stop those annoying leaks. And no, we're not just talking about surgery. Whether it's through small lifestyle changes, simple exercises, or personalized treatment plans, you have options, and you don't have to live in fear of your bladder. So stick with me, because by the end of this video, you'll have a clear, confident understanding of what causes incontinence, what symptoms to look for, and most importantly, how to take control again. So, how do you know if what you're experiencing is urinary incontinence? Well, the symptoms actually depend on the type of incontinence you have. Yes, there's more than one type, and understanding the difference can be a game changer in getting the right help. Let's break down the 3 most common types in a way that's simple and easy to remember. First, we have stress incontinence. This is one of the most common types, especially in women, particularly after childbirth. It happens when physical pressure on your belly, like when you laugh, cough, sneeze, or lift something heavy, causes your bladder to leak a little. Think of it like this: your bladder is under stress, and it can't hold on. Next is urgency incontinence, also known as overactive bladder, or OAB. This one's all about that sudden, powerful urge to pee, the kind that hits out of nowhere and can be so intense, you might not make it to the bathroom in time. Sometimes you might not even leak, but the urge itself feels impossible to ignore. It can be really disruptive, especially when you're out in public or far from a bathroom. And finally, there's mixed incontinence, and as the name suggests, it's a combination of both stress and urgency incontinence. You might leak when you laugh and feel sudden urges to go. It can feel like a double challenge, but don't worry. Knowing what you're dealing with is the first step toward taking back control. The important thing to remember is, these symptoms are common, but they're not normal, and you don't have to just live with them. Whether it's a few drops or a full accident, your body is telling you something. And the good news, there are solutions, and we'll cover them in just a moment. Now here's the good news. You don't have to wait for a doctor's appointment to start feeling better. There are simple, smart steps you can take right now at home to reduce those annoying leaks and regain control. Let's dive into some of the most effective habits that really make a difference. First, watch your fluids before bedtime. Try to reduce how much you drink a few hours before you go to sleep. That way, you're less likely to wake up needing the bathroom, or worse, leak in your sleep. Next, avoid bladder irritants. Things like caffeine, alcohol, spicy or acidic foods can really irritate your bladder and make leaks worse. Cutting back on these can calm things down and help you feel more in control. If you're carrying extra weight, losing some pounds can help a lot. Excess weight puts pressure on your bladder and pelvic muscles, making leaks more likely. Even a small weight loss can ease that pressure and improve symptoms. For those with diabetes, managing blood sugar is key. High blood sugar can increase urine production and irritation, so keeping it in check can reduce your symptoms and improve overall bladder health. And here's a pro tip for people taking diuretics. Those water pills that make you pee more. Try to time your medication so you'll be close to a bathroom for a few hours afterward. Planning ahead means fewer surprises and more confidence to go about your day. These habits might sound simple, but together, they can add up to big improvements in how you feel and control your bladder. Next, we'll talk about exercises and techniques you can use to strengthen your bladder even more. So stay tuned. Let's talk about two of the most powerful tools you can use to take back control of your bladder. And the best part, you can start doing them right now. The first technique is called bladder retraining. Here's how it works. Instead of rushing to the bathroom the moment you feel the urge, you train your bladder to hold it a little longer. You start by going at set times, maybe every hour, whether you feel like you need to or not. Then, as you get used to it, you gradually increase the time between bathroom visits. The ultimate goal, to stretch that time to 3 or even 4 hours between visits, giving you more freedom and fewer interruptions throughout the day. Now, onto the second technique, pelvic floor exercises, often called Kegels. These exercises strengthen the muscles that help keep urine from leaking. But here's the catch. Most people don't do Kegels correctly, which means they don't get the full benefits. That's why it's super important to ask your doctor, nurse, or a pelvic floor therapist to show you the right way to do them. With the proper technique, you'll build muscle strength that supports your bladder and helps stop leaks. Remember, these aren't quick fixes. But with small, consistent steps like these, you can see big results over time. So don't get discouraged. You've absolutely got this. And every effort you make is a step toward better bladder control and a better quality of life. At this point, you might be wondering, should I see a doctor? The answer is a strong yes. Especially if the leaking is affecting your daily life or your confidence. Your doctor or nurse can help you figure out what's really causing your incontinence, and more importantly, how to fix it. They'll ask the right questions, maybe run a few simple tests, and then recommend treatment options that are tailored just for you, based on your symptoms, your health history, and whether you're male or female. And don't forget to bring up your medications. Some medications can actually cause or worsen incontinence, including diuretics, certain antidepressants, and even blood pressure meds. So, it's important to ask, could any of the pills I'm taking be making this worse? A simple medication adjustment might make a huge difference. The bottom line, you don't have to figure this out alone. There are professionals who deal with this every day, and they're here to help. The sooner you speak up, the sooner you can start feeling more confident, more comfortable, and more in control. Now let's talk about the part many people are really waiting for. How is urinary incontinence treated? First, it's important to understand that there's no one-size-fits-all answer, and that's a good thing. Treatment depends on 2 key factors. 1. The type of incontinence you have. And 2. Whether you're male or female, since the causes and anatomy can be different. Now, here are a few of the most common treatments your doctor might recommend. And no, it's not always surgery. Let's start with medications. These are often prescribed to help relax the bladder muscles, which reduces that constant urge to go, or helps stop unexpected leaks. For many people, The right medication can make a huge difference in daily life. Next up is surgery. But don't worry, this is usually a last resort, and not everyone needs it. Surgery may be recommended if your bladder has weakened tissues or if there are structural issues affecting how urine flows. It can tighten or support the bladder and urethra, helping you hold in urine more effectively. And here's something that surprises a lot of people: nerve stimulation. This involves using gentle electrical pulses to stimulate the nerves that control your bladder. It might sound high-tech, and it kind of is, but it can help calm an overactive bladder and reduce sudden urges. The most important thing to remember is this: you don't have to suffer in silence. Incontinence is common, it's treatable, and there is help available. So whether it's through medication, therapy, or advanced techniques like nerve stimulation, the right treatment is out there, and it could truly change your life. Now you might be wondering, what will my life actually look like if I'm dealing with incontinence? The honest truth: there's hope, and there's help. Most people with incontinence, whether it's mild or more severe, can regain control or at least dramatically reduce how often they leak. The key is simple: don't stay silent. That first conversation with your doctor or nurse, it might feel awkward, but it could completely change your life. Incontinence is a medical issue, not a personal failure, and you have every right to get support and solutions. Once you speak up, you can start working with your healthcare provider to create a personalized plan, one that fits your body, your lifestyle, and your goals. For some people, it's all about small changes in diet, timing, or habits. For others, it might include pelvic floor exercises, medication, or even advanced treatments. Whatever the path, the most important thing is this: this situation is not unique to you. Millions of people are going through the same thing. And you don't have to just deal with it, or accept it as a normal part of aging. Because it's not. So take charge. Not just of your bladder, but of your life. You deserve to feel confident, comfortable, and in control. And that journey can start today. Incontinence is common, but it's not permanent. And you've got options. Urinary incontinence might be common, but that doesn't mean you have to live with it. Your next steps start right now. Talk to your doctor or nurse. Even one honest conversation can change everything. Try the lifestyle tips, the bladder retraining, and those pelvic floor exercises we shared today. And most importantly, know that you can improve your bladder control. Let's break the stigma together. If you learned something new, give this video a thumbs up. It really helps us reach more people. Got a story to share or a question? Drop it in the comments. Someone out there needs to hear that they're not alone. Share this with a friend or family member who might be struggling in silence. You never know whose life you could change with just one click. And hit that subscribe button for more real, trusted health info that actually helps. Remember, you are not alone, and you are not powerless. Together, we can raise awareness and bring real solutions to light. Thanks for watching, and here's to living life with more confidence, more comfort, and more control. I will see you in the next one.